$5,000 a year. That's the average extra cost a retiree pays by picking the wrong Medicare option at 65. Not the wrong doctor, not the wrong plan, the wrong category. Medicare Supplement versus Medicare Advantage. Pick one for the rest of your life. The system makes it nearly impossible to switch back later. Most retirees pick Advantage. The commercials make it sound free. Same as regular Medicare, plus extras at zero premium. It's marketed harder. Insurance brokers earn higher commissions on Advantage. The TV ads with the dancing senior in the park push you there. What the ads don't say. Once you choose Advantage, switching to Supplement later is almost impossible without medical underwriting. Develop cancer, diabetes, or heart trouble after enrolling, and the supplement insurer can refuse you. The window to choose Supplement without that risk closes 6 months after you turn 65. Permanently. In the next 10 minutes, I'll show you the real cost difference between the two systems, the 4 scenarios where each one wins, the 6-month enrollment window that locks in your choice, the magic sentence to use when you call Medicare, and the one question every retiree should ask before picking. There's a quiet moment about 3 months before your 65th birthday. The Medicare welcome packet arrives. The CMS pamphlet is 26 pages. The Advantage plan brochures from United Health, Humana, Aetna, and Blue Cross all arrive within the same week. Each one looks attractive. Each one promises savings. Nobody in the packet tells you the most important fact. The decision you make in the next 6 months is largely permanent for the rest of your life. Today we fix that. 5 moves. Move 1, what each plan actually is. Original Medicare. 2 parts. Part A covers hospital stays. Part B covers doctor visits and outpatient care. Together, they cover roughly 80% of typical medical costs. You pay the standard Part B premium, about $185 a month in 2026. The other 20%, your share of every doctor visit, every hospital stay, every test, comes out of your pocket. To cover that 20% gap, you have 2 paths. Path A, Medigap, also called a Medicare Supplement, a private insurance policy that pays the 20% original Medicare doesn't. Premium runs $150 to $350 a month depending on the plan letter. Plan G and Plan N are the most popular. Your out-of-pocket costs nearly vanish. Path B, Medicare Advantage, a bundled private insurance plan that replaces original Medicare entirely. Premium often advertised as zero. The Advantage plan handles all your medical bills. In return, you accept a network of doctors, prior authorization rules, and co-pays at each visit. Out-of-pocket maximums in 2026 can reach $9,350 per year. Move 2. The real cost, over 20 years of retirement. Let me run the math on a 65-year-old in average health. Scenario A, Medicare Advantage, zero premium plan, average annual co-pays and out-of-pocket, $2,500 in a typical year. In a bad medical year, surgery, hospitalization, cancer treatment, out-of-pocket hits the cap at over $9,000. Average across 20 years of retirement, roughly $50,000 in cumulative out-of-pocket costs. Scenario B, Medigap Plan G with Part B. Premium runs about $2,800 a year, almost zero additional out-of-pocket. 20-year cost, $56,000 in premiums. On paper, similar, but the variability matters. With Advantage, your worst year can cost $9,000 in cash. With Supplement, every year is roughly the same. Take a chap I sat with. Call him Henry, same Henry. 68, diagnosed with prostate cancer at 67. He picked Advantage at 65 because the zero premium looked great. Treatment ran 4 hospital stays, 8 specialist visits, and 26 radiation sessions. Total out-of-pocket, $9,350. That same year, his neighbor with Supplement paid $280 total, just the Part B deductible and a small monthly supplement premium. Difference, $9,000 in 1 year. The kind of difference that delays a retirement. Move 3, the 4 scenarios where each one wins. Medicare Advantage wins when 1. You're healthy and stay that way. Average annual costs run low. The zero premium saves you real money. 2. You don't travel much. Advantage networks are usually local. 3. You want vision, dental, and hearing benefits bundled in. Original Medicare doesn't cover these. Most Advantage plans do. 4. Your Advantage plan has the doctors and hospitals you actually use. Medicare Supplement wins when 1. You have any chronic condition diagnosed or family history of one. Predictable costs every year. 2. You travel often. Supplement is accepted by any doctor who takes Original Medicare. 3. You value freedom from prior authorization rules. Supplement requires 0. 4. You want to choose specialists without referrals. Move 4. The 6-month window that locks in your choice. Here's the rule almost nobody understands until it's too late. When you first enroll in Medicare Part B, you get a 6-month window, called the Medigap open enrollment period, during which supplement insurers must accept you regardless of health history. No questions, no exam. After that window closes, supplement insurers in most states can refuse you for any pre-existing condition. They can charge you triple. They can deny you outright. The window does not reopen. Medicare Advantage has no such restriction. You can enroll in Advantage during any annual open enrollment period for the rest of your life. So the asymmetry. If you pick Advantage first and later try to switch to supplement, say you developed a chronic condition during Advantage, the supplement insurer can refuse you. You're stuck on Advantage forever. If you pick supplement first and later want to switch to Advantage, you can do it any year. No medical questions. The door swings only one way. Take Margaret, same Margaret, 68. Picked Advantage at 65 because her friends did. At 67, she developed atrial fibrillation. At 68, she tried to switch to a supplement so she could see a specialist out of network. 2 supplement insurers refused. The third charged her $390 a month for a plan that would have cost $250 if she had picked it at 65. The premium difference compounds over the next 15 years, $25,000 more in lifetime cost, because of one missed window. The magic sentence to use when you call Medicare at 1-800-MEDICARE, that's 1-800-633-4227. Quote, I'm enrolling in Part B for the first time. What's my Medigap open enrollment period start and end date? End quote. Write down those exact dates. Pin them to your fridge. Move 5. The one question every retiree must ask before picking. If you do nothing else from this video, ask yourself this one question before you choose. Quote, if I develop a chronic illness in the next 5 years, can I still afford this plan? End quote. If the answer is no, supplement is the safer pick. Higher, steady premium, lower variance, predictable. If the answer is yes, Advantage may save you real money if you stay healthy. But understand the asymmetry. The door swings only one way. For most retirees in average health with average savings, supplement is the lower risk pick. The higher premium is the insurance you're paying to keep options open. You've worked decades to retire. Don't let one 6-month window decide the next 20 years of your health care. 5 moves. Understand what each plan actually is. Run the 20-year math. Know the 4 win scenarios for each. Mark the 6-month window. Ask yourself the chronic illness question. If even one of these saved you $1, hit subscribe. New videos every Tuesday and Friday. In the comments, tell me which plan you picked or are planning to pick. I read everyone. I'll see you in the next one.